Hello, namaste everyone. Welcome to our YouTube channel Dr. D18. Here we are going to discuss some important questions of the topic body fluids and circulation. So the first question is, which of the flowing blood vessels in the circulatory system of the frog has more deoxygenated blood? So option number 1 is pulmonary artery, option B is precaval veins, and option C is pulmocutaneous artery, and option D is pulmocutaneous vein. So in the frog, more deoxygenated blood is carried by the pulmonary artery. So the correct option is this option number A, pulmonary artery. Now question number 2, which one indicates the hypertension or the high blood pressure? Option number 1 is 120 by 80, option B 110 by 70, option C 130 by 80, option D is 140 by 90. So for the hypertension, the systolic blood pressure must be 140 and the diastolic blood pressure must be 90. So the option D is correct. So the option D is correct. Now let's move on question number 3. Identify the correct statement. Option O. Identify the correct statement. The first statement is the impulse of the heartbeat. The impulse of the heartbeat originates from the SA node. It's absolutely right. Now the rate of the heart is determined by SA node. It's also right. So here is the bundle of His is present in the interventricular septum. No, the bundle of His is the only means to transmit the impulse from the auricle to the ventricle. So option statement 4 is AV node is situated in the lower left corner of the right auricle. So this is also correct. So if we see in the option A, all except 2, no, this is not, all except 1, all except 3, and D, all of these. So all the statements are correct except statement 3. Now let's move to the next question. Choose the correct pathways on the transmission of the impulse in the heartbeat. Option number A is AV node. Wrong, because the transmission of impulse in the heartbeat originates from the SA node. So option number B is SA node to AV node to bundle of His and the Purkinje fibers. So this is the correct option. Option number B is the correct. Now question number 5. Water circulatory system is found in. So water circulatory system is found in option A, sponge. Okay, this lie in the porifera. Option number 2 is hydra. Option number 3 annelida, starfish, and arthropoda. So water circulatory system is found in the sponges and hydra and then the starfish. So the correct option is option 1, 2, 3, no, B 3, 4 and 3, 4 and 5. No, this is the wrong option. C 1, 2 and 4. So this is the right answer. Now, which of the following is an example of the buffer system in blood? Hemoglobin and oxyhemoglobin. This is the wrong option. Oxygen and the carbon dioxide, albumin and the globulin, and the sodium bicarbonate and the carbonic acid. So first of all, we should know about the buffer system. Buffer system is the which can take hydrogen and which can also give the hydrogen to maintain the pH of our blood. So in our blood, sodium bicarbonate and carbonic acid acts as the buffer system. So the option number D is the correct answer. Now in an open circulatory system, there is no distinction between the blood and the tissue fluid. Okay, of tissue fluid is absent, no need of the blood vessels, no open space or the sinuses are absent. So here the correct option is there is no distinction between the blood and the tissue fluid. Both are mixed in the open circulatory system. So the option number A is the correct. Now primary blood cells are formed in. So the blood cells are formed in the option number A plasma, option B bone marrow, option C liver, and option D spleen. So the primary blood cells are formed in the bone marrow, and the process of this formation of the blood cells is hemopoiesis. Okay. Now the properties of the leukocytes are they are the nucleated. Okay, this is the correct option. They are denucleated like RBCs. No, this is the wrong option. They are 6,000 to 8,000 mm³ of the blood. Okay, this is the correct. And they are the long lived. No, they are the short lived, only for the few weeks. Okay, so they are the short lived. So option number 1, 3 and statement 5, 1, 3 and 5 are the correct. So choose the appropriate option 1, 3 and 5. So the option number A is correct. Now impulse can generate SA node can generate the impulses. So SAN can generate the impulses in 1 minute. There is about 72 beats per minute. So the SAN also generates impulses 70 to 75 per minute. So the correct option is A. Now hematuria means RBCs in the urine. So hematuria means the RBCs in the urine. Okay, this is the correct. WC is in the urine. WBC in the urine is called the pyuria. Pyuria. This is called the pyuria. So both A and B, D none of this. So hematuria means the RBCs in the urine. Option number A is the correct. Now an oval depression called the fossa ovalis is seen on the interatrial septum, interventricular septum, and the right auriculoventricular septum and the left auriculoventricular system. So here the correct option is interatrial septum. Now which of the following acts as a middleman of the body? Option number A is plasma, B is lymph, C is RBCs, and D is also RBCs. So here the option number B, lymph, acts as a middleman of the body. Okay. Now the coronary heart disease is due to the streptococci bacteria. No. B, inflammation of the pericardium. No. Then the C, weakening of the heart valves. No. This insufficient blood supply of the heart muscles. Okay, this is the correct answer. Insufficient blood supply to the heart muscle cause the coronary heart disease. This is the correct option. Now pulse beat is measured from arteries, veins, capillaries. D. So the pulse originates from the contraction of the aorta. So the aorta, after the aorta, it gets branched into artery. So the pulse beat is measured from the arteries. Correct option is A. Okay, thank you. I hope this may be the useful for you.